Have you ever wondered what really happens inside your body when you drink just one glass of baking soda water? Imagine opening your kitchen cupboard, reaching for a simple white powder you barely notice, only to discover it holds the potential to quietly transform your health. This humble kitchen staple, often overlooked in daily life and rarely spotlighted in mainstream health conversations, is surprisingly recommended by some doctors. But is it truly the hidden secret to better digestion, stronger energy, and overall wellness? Or are there hidden risks lurking beneath its simple appearance? In this video, we'll uncover 7 little-known health benefits of drinking baking soda water and reveal exactly how to prepare it safely to maximize results and avoid common mistakes. More importantly, we'll explain the crucial precautions you need to know, because the difference between a powerful benefit and an unexpected risk often comes down to just a few small steps. Before we dive in, make sure you subscribe to our channel so you never miss valuable health insights like this. And tell us in the comments, where in the world are you watching from? We'd love to hear from you and build a growing community focused on simple, smarter health choices. Let's start by exploring one of the most immediate benefits you can experience: how baking soda water quickly soothes digestive discomfort. Digestive discomforts like acid reflux, heartburn, bloating, and indigestion are everyday struggles for millions, often disrupting meals and affecting quality of life. At the root of these issues is one common thread: excess stomach acid irritating the sensitive tissues of the esophagus and stomach lining. Baking soda water offers a straightforward, scientifically supported method to neutralize this acid and restore digestive comfort naturally. When sodium bicarbonate, baking soda, enters the stomach, it reacts immediately with hydrochloric acid, HCl, producing salt, water, and carbon dioxide gas. This neutralization process rapidly raises the pH of stomach contents, reducing acidity and alleviating the burning sensations associated with acid reflux and heartburn. The simplicity of the reaction is its strength, providing fast, tangible relief without the need for complex interventions. The evidence supporting this effect is not merely anecdotal. A 2022 study published in BMJ Open Gastroenterology evaluated individuals struggling with frequent heartburn. Participants who consumed bicarbonate-rich mineral water experienced significant improvements in their symptoms compared to those receiving a placebo. The rapid pH shift created by bicarbonate intake directly correlated with reduced esophageal irritation, offering a clear validation for baking soda's traditional use. Beyond heartburn, baking soda water addresses broader digestive discomforts like bloating and indigestion. Heavy meals, especially those rich in fats or acids, often slow gastric emptying and cause a buildup of gas and pressure within the stomach. This leads to sensations of fullness, discomfort, and nausea. By neutralizing excess acid and promoting a more balanced stomach environment, baking soda helps ease these symptoms, encouraging smoother digestion. Supporting this, findings from the American Journal of Gastroenterology highlight sodium bicarbonate's effectiveness in relieving dyspepsia, the medical term for chronic indigestion. Patients who used sodium bicarbonate solutions reported faster relief from bloating, nausea, and stomach pain compared to conventional methods. The study emphasized that correcting gastric acidity plays a crucial role in resolving these upper digestive issues, particularly when symptoms are triggered by dietary factors. While antacid tablets are widely marketed for similar purposes, baking soda offers an advantage in terms of immediacy and accessibility. Dissolving a small amount in water creates an alkaline solution that begins working within minutes, without the need for additional chemical additives often found in commercial products. Its versatility also allows for tailored dosing, depending on the intensity of symptoms. That said, proper use is critical. Baking soda water is intended for occasional support rather than long-term daily use. Overconsumption risks upsetting the body's electrolyte balance and increasing sodium load, which can have serious consequences, particularly for individuals with hypertension or kidney concerns. The goal is not to suppress all stomach acid indefinitely. Acid plays a vital role in digestion and nutrient absorption, but to provide targeted relief during episodes of discomfort. Next, let's uncover how baking soda can play a powerful role in supporting kidney health and maintaining your body's internal balance. Maintaining the delicate acid-base balance of the blood is fundamental for healthy kidney function. When acid levels rise beyond normal thresholds, the kidneys are forced to work harder to excrete the excess, accelerating damage over time. Baking soda, through its natural alkalizing effect, helps ease this burden by neutralizing systemic acidity and supporting a healthier internal environment. As the body's primary filtration system, The kidneys regulate not only waste removal but also the acid-alkaline status of the blood. A persistently acidic state, known as metabolic acidosis, is common among individuals with declining kidney function and directly contributes to faster disease progression. Introducing baking soda into the system buffers this acidity, helping maintain blood pH within the narrow ideal range of approximately 7.35 to 7.45, critical for optimal enzymatic reactions, cellular processes, and overall metabolic health. Clinical research validates this role. A meta-analysis published in Frontiers in Pharmacology in 2021 reviewed multiple studies assessing the impact of oral sodium bicarbonate supplementation in patients with chronic kidney disease, CKD. Results consistently showed that those who took sodium bicarbonate experienced a slower decline in kidney function compared to untreated individuals. Improvements in bicarbonate serum levels indicated better acid control, and patients often showed secondary benefits like reduced muscle wasting and cardiovascular protection, complications commonly linked to chronic acidosis. Beyond kidney-specific benefits, stabilizing systemic pH has wide-ranging physiological impacts. Acidotic conditions disrupt cell membrane integrity, inhibit enzyme activity, and impair the body's ability to repair tissues efficiently. By providing an accessible source of bicarbonate ions, baking soda supports cellular resilience under stress, helping vital systems operate closer to their intended efficiency. A complementary study published in the Journal of Nutritional Biochemistry in 2024 explored how bicarbonate-rich mineral water affected acid-base balance in otherwise healthy adults. Participants demonstrated a significant rise in urinary pH alongside a reduction in net acid excretion, reflecting a meaningful systemic shift toward alkalinity. Although the study focused on healthy individuals, the findings reinforce the broader principle that buffering excess acid can promote internal stability even before major organ damage sets in. While pharmaceutical bicarbonate formulations exist for patients with advanced CKD, baking soda offers a simple, widely available alternative for those at earlier stages or seeking preventive measures. However, precision matters. Sodium content must be monitored carefully, especially in populations at risk for hypertension or fluid retention. Used thoughtfully, under proper guidance, baking soda supplementation represents an elegant method to lighten the workload on the kidneys and protect against the silent erosion caused by chronic low-grade acidosis. Now, let's explore how baking soda can help create a healthier environment in your urinary tract and support natural defense against infections. Urinary tract infections, UTIs, develop most easily in an acidic environment where bacteria such as Escherichia coli can adhere to and colonize the urinary lining. Modifying that environment by increasing the urine's pH can create conditions that are far less favorable for bacterial growth. Baking soda, when dissolved in water and consumed, elevates urinary pH, offering a simple but strategic way to support the body's defenses during early stages of urinary discomfort. By introducing bicarbonate ions into the bloodstream, baking soda indirectly impacts the acidity of urine. The kidneys excrete bicarbonate along with waste, leading to a measurable rise in urinary pH. When the urine becomes less acidic, bacterial adhesion weakens, biofilm formation slows, and the inflammatory response within the urinary tract is reduced, offering symptomatic relief. Scientific validation comes from a 2017 study published in the International Urogynecology Journal, where researchers investigated the effects of oral sodium bicarbonate supplementation in women experiencing lower urinary tract symptoms linked to acidic urine. Over the course of 4 weeks, participants who consumed baking soda saw their average urinary pH rise from 5.3 to 7.2, a dramatic shift into a range far less hospitable to infection. Correspondingly, they reported improvements in frequency, urgency, and discomfort, particularly during nighttime hours when symptoms typically intensify. The underlying mechanism is elegantly simple. Pathogens like E. coli possess acid-tolerant adhesion factors that allow them to anchor onto the uroepithelium under low pH conditions. Elevating the pH disrupts these bacterial survival strategies, limiting their ability to multiply and cause persistent symptoms. Unlike antibiotic therapy, which directly kills bacteria but may disrupt gut flora and contribute to resistance, alkalizing urine through baking soda offers a supportive approach that strengthens natural defenses without pharmacological intervention. This buffering strategy is particularly appealing for individuals prone to recurrent UTIs, where preventative measures and early symptom management can substantially reduce the need for antibiotics. By using baking soda water at the first sign of discomfort, such as mild burning or increased urgency, it may be possible to tilt the balance early enough to allow the body's immune response to resolve minor infections before they escalate. However, it is crucial to recognize that baking soda water is not a substitute for antibiotics when a full infection has developed. Left untreated, UTIs can ascend into the kidneys and cause serious complications. The appropriate role of baking soda lies in prevention, symptom management, and early-stage support, rather than serving as standalone therapy for established infections. Let's dive into how baking soda can boost your endurance during workouts and help your muscles recover faster afterward. During intense exercise, the accumulation of metabolic byproducts like lactic acid lowers muscle pH, leading to fatigue, burning sensations, and eventual performance decline. Managing this acid buildup is critical for both extending physical output during activity and accelerating recovery afterward. Baking soda, with its inherent buffering capabilities, offers a straightforward method to counteract these effects, optimizing both endurance and post-exercise resilience. When consumed before exercise, baking soda increases blood bicarbonate levels, enhancing the body's ability to neutralize excess hydrogen ions produced during anaerobic metabolism. By stabilizing pH within the muscle tissue, athletes can sustain high-intensity efforts longer before experiencing the debilitating impact of acidosis. The additional buffering capacity delays the onset of muscle failure, allowing for prolonged exertion and improved performance across various activities, from sprinting to competitive rowing. Evidence for this performance boost is strong. A 2019 study published in the Journal of the International Society of Sports Nutrition demonstrated that athletes who ingested sodium bicarbonate approximately 1 hour before high-intensity workouts were able to perform for significantly longer durations compared to a placebo group. The researchers noted reductions in perceived exertion and a measurable delay in muscle fatigue, confirming that strategic bicarbonate loading can enhance physical endurance without reliance on more invasive interventions. Beyond its role during activity, baking soda also supports faster recovery post-exercise by aiding in the restoration of normal muscle pH levels. High-intensity exercise induces a residual acidosis that contributes to delayed onset muscle soreness, DOMS, a phenomenon characterized by stiffness, tenderness, and reduced functional capacity for up to several days after exertion. By providing an alkaline buffer, baking soda helps neutralize lingering acidity, promoting a quicker return to baseline muscle function and reducing the intensity of soreness. Research from Frontiers in Nutrition reinforces this dual-phase benefit. Studies found that individuals supplementing with sodium bicarbonate not only performed better during strenuous workouts but also experienced less muscle discomfort and a faster restoration of acid-base balance afterward. This advantage allows for more consistent training schedules, minimizing downtime and maximizing cumulative gains over time. Application timing is crucial to harness the full benefits. Pre-exercise supplementation typically involves consuming 0.2 to 0.3 grams of baking soda per kilogram of body weight about 60 to 90 minutes before activity. Post-exercise, smaller doses can assist with pH normalization without introducing gastrointestinal distress, a common side effect if excessive quantities are consumed at once. Personalized dosing strategies ensure that athletes optimize benefits while minimizing risks. Up next, discover how baking soda can support gout management by helping your body handle uric acid more effectively. Gout is fundamentally a disease of imbalance, a buildup of uric acid in the blood that crystallizes in joints, causing sudden, intense pain and inflammation. Correcting the internal environment to favor uric acid solubility is a key strategy in managing this condition. Baking soda, with its ability to raise blood and urinary pH, offers a mechanism to make uric acid more soluble and less prone to form damaging crystals. When sodium bicarbonate is ingested, it increases systemic bicarbonate levels, leading to a gradual shift in the body's acid-base balance toward a more alkaline state. This alkalization has a direct impact on uric acid behavior. In more acidic conditions, uric acid tends to precipitate and form crystals. In a more alkaline environment, it remains dissolved and can be more easily excreted through the kidneys. By elevating both blood and urine pH, baking soda effectively reduces the biochemical conditions that favor gout flare-ups. Clinical research supports this approach. A 2024 study published in the British Journal of Hospital Medicine explored the use of baking soda supplementation alongside conventional gout medications. Participants who combined sodium bicarbonate with standard urate-lowering therapy showed significantly greater reductions in serum uric acid levels compared to those on medication alone. Imaging studies confirmed that the bicarbonate group exhibited fewer crystal deposits within joints, correlating with fewer and less severe gout attacks during the study period. The mechanism is both elegant and efficient. By preventing supersaturation of uric acid in the bloodstream and facilitating its clearance through alkalized urine, baking soda addresses a root factor in gout pathology without directly interfering with purine metabolism or kidney function. Instead, it modifies the environment, making the system less hospitable to crystal formation and thereby easing the inflammatory cascade associated with gout flares. For patients with recurrent or severe gout, managing pH through dietary adjustments alone can be challenging, particularly given the acid-forming nature of many common foods. Baking soda provides a supplemental tool that can enhance traditional dietary strategies, offering a practical way to maintain more consistent alkalinity without extensive dietary overhauls. It acts as a buffer against unavoidable dietary acid loads, providing a steady line of defense between meals and flare-ups. Proper integration of baking soda into gout management requires precision. Dosages must be carefully tailored to avoid excessive sodium intake, which can pose risks for individuals with hypertension, heart disease, or kidney impairment. Small, controlled amounts, timed strategically around meals, can offer the benefits of alkalization without tipping electrolyte balance too far in the opposite direction. Baking soda's role is not to replace pharmaceutical interventions, but to complement them. By optimizing the internal terrain, it amplifies the effectiveness of medications aimed at reducing uric acid production or increasing its excretion. The combination approach, medication to reduce load, baking soda to improve solubility and clearance, targets multiple stages of uric acid dynamics, offering a more comprehensive strategy for long-term gout control. Let's see how baking soda can naturally freshen your breath and support a healthier mouth environment. The health of the mouth is highly dependent on maintaining a balanced pH environment. Acidic conditions promote the growth of harmful bacteria, leading to bad breath, gum inflammation, and the development of mouth sores. Baking soda, through its natural alkalizing action, shifts the oral environment away from acidity, offering a direct method to support fresher breath and reduce minor oral irritations. When baking soda is used as a rinse or consumed in diluted form, it neutralizes excess acids within the mouth. This pH shift suppresses the proliferation of anaerobic bacteria responsible for producing volatile sulfur compounds, the primary source of foul breath odors. By weakening the acidic foundation these bacteria rely on, baking soda not only masks unpleasant smells but targets one of their root causes. Research validates this effect. A 2008 study published in the Journal of Clinical Dentistry demonstrated that participants using a baking soda mouth rinse experienced a measurable increase in oral pH and a significant reduction in bad breath compared to those using plain water. The study highlighted that neutralizing oral acidity was a critical factor in improving breath freshness sustainably, rather than simply covering odors temporarily. Beyond freshening breath, baking soda offers therapeutic benefits for minor oral irritations. Canker sores, mild throat inflammations, and gum sensitivity often worsen in an acidic environment where tissue healing is compromised and inflammatory processes are amplified. By raising the local pH, baking soda creates a setting more conducive to natural healing, reducing the discomfort and swelling associated with these conditions. Further supporting evidence from the Journal of the American Dental Association confirmed that regular use of a baking soda solution reduced bacterial counts in the oral cavity, particularly strains associated with gingivitis and early periodontal disease. The mild antiseptic properties of baking soda help control microbial load without the harshness of alcohol-based mouthwashes, making it suitable for daily use, especially for individuals with sensitive oral tissues. Application methods vary depending on the objective. For breath freshness, a simple rinse made by dissolving half a teaspoon of baking soda in a cup of warm water, swished thoroughly around the mouth, can deliver immediate results. For mouth ulcers or throat discomfort, gargling with a baking soda solution soothes irritated tissues while helping to cleanse and protect against further bacterial invasion. Unlike many commercial products laden with artificial flavors and alcohol, baking soda offers a minimalistic, non-irritating approach to oral care. Its compatibility with the body's natural buffering systems means it works with physiological processes rather than against them, promoting not just symptom relief but deeper oral resilience. Now, let's explore how baking soda can help soothe irritated skin and bring gentle, natural relief. Skin irritation often stems from an imbalance in surface pH, where excessive acidity compromises the skin's protective barrier, promotes inflammation, and intensifies itching. Baking soda, with its mild alkalizing properties, provides an effective way to restore pH balance and soothe irritated skin naturally. When dissolved in water, baking soda creates a gentle alkaline solution that, when applied externally, neutralizes surface acids without disrupting the skin's essential functions. By rebalancing the local pH, it reduces irritation signals, calms inflamed tissues, and diminishes the intensity of itching, key factors in managing conditions such as eczema, psoriasis, heat rashes, and minor allergic reactions. Clinical evidence supports this mechanism. A study published in the Journal of Dermatological Treatment evaluated the effects of baking soda baths on patients with chronic pruritic conditions. Participants who regularly soaked in baking soda-enriched water reported significant improvements in itch severity, skin texture, and overall comfort compared to those using plain water soaks. The alkaline environment appeared to protect damaged skin, minimize further irritation, and encourage gradual healing by reducing inflammatory mediators on the surface. Beyond its buffering action, baking soda acts as a mild cleanser, helping remove irritants like sweat, bacteria, and environmental pollutants that can exacerbate skin symptoms. Unlike many commercial soaps and body washes, which may contain harsh detergents and fragrances that worsen dryness or sensitivity, baking soda offers a minimalist, non-aggressive cleansing alternative ideal for compromised skin barriers. For individuals managing eczema, where flare-ups are often triggered by small pH shifts and minor environmental insults, regular baking soda soaks offer a preventive strategy. By consistently maintaining a less acidic skin surface, the frequency and severity of flare-ups can be reduced, allowing for longer periods of skin stability. In cases of psoriasis, where thickened, scaly plaques dominate, baking soda baths can help soften plaques, making other topical therapies more effective and improving skin appearance and comfort. Application is straightforward. Adding 1 to 2 cups of baking soda to a bathtub of lukewarm water and soaking for 15 to 20 minutes can deliver noticeable relief. For localized irritations, such as insect bites, patches of eczema, or heat rashes, a concentrated paste made by mixing baking soda with a small amount of water can be applied directly to affected areas. Once dry, the paste can be gently rinsed off, often leaving behind calmer, less inflamed skin. Because baking soda is chemically mild, it is generally well tolerated, even by individuals with sensitive or reactive skin. However, moderation remains essential. Excessive use or overly concentrated solutions may dry the skin, emphasizing the importance of using appropriate dilutions and following soaks with a gentle moisturizer to lock in hydration. To prepare baking soda water correctly, simply dissolve half a teaspoon of baking soda into approximately 200 milliliters of water. For best results, it's recommended to drink it either first thing in the morning on an empty stomach to support digestion, or 1 to 2 hours after a meal to ease any lingering discomfort. However, it's crucial not to exceed 1 glass per day and to avoid using baking soda water continuously over long periods without medical supervision. Certain individuals need to exercise extra caution. Those with kidney disease, high blood pressure, heart conditions, or who are following a sodium-restricted diet should consult their doctor before using baking soda water. Pregnant women, individuals experiencing persistent bloating, and those currently taking antibiotics or antacid medications should also seek medical advice before incorporating it into their routine. Proper guidance ensures that the benefits can be enjoyed safely without risking adverse effects. If you've ever tried baking soda water, or are planning to, we'd love to hear your experience. Share your thoughts in the comments below, and don't forget to like this video, subscribe to our channel for more natural health tips, and check out the next videos we've selected just for you. Let's keep growing this health-focused community together.